Hey everybody, this is Dan. Just wanted to do a quick video on how to treat the suprahyoid muscles. So these are the muscles that attach from the bottom of your jaw here, the mandible, down to the hyoid bone. They form the floor of your mouth. And these are really crucial in determining the position of the jaw. And a lot of times people with a head forward posture, I'll find that these muscles are tight on them as well. And it's really crucial to treat these before you start treating any of the other more global, bigger muscles that really influence the position of the head and neck and really contribute to head forward posture. Really essential that you get all these tissues nice and loose first. These techniques that I'm about to show, they work really well with the techniques that I showed in the previous video on lymph drainage. If you do the lymph drainage techniques first, it helps flush waste products from the tissue, and it really better prepares them to receive the changes that these kind of techniques that I'm about to show bring. So the first thing that you want to do is you want to find your hyoid bone. That's right here. So you find your thyroid cartilage or your Adam's apple, and then you just go about 1 finger width up, and you should feel the edges of the hyoid bone on either side in your on your thumb and forefinger. And then I can show you a picture right here. So this is from TIMA, Atlas of Anatomy. This is the hyoid bone right here, and these are all the muscles that form the floor of the mouth. The suprahyoid muscles, these are the infrahyoid muscles here, and this is another angle, the muscles of the floor of the mouth from inside the mouth. And you can see these really cool muscles right here also attached to the front of the jaw. So they pass through this little fibrous loop here. These are your digastric muscles and your stylohyoid muscles. Let's see if we can get a better shot of that. There we go, right there. And the styloid process is this little bony protrusion right here next to that mastoid process. So I'll show you where that is. So mastoid process, that bony bump right here. If you kind of fall off of that with your middle finger and sink into that tissue between the edge of your jaw and your mastoid, you should be able to feel that little bony protrusion of the styloid process right here. And if you keep sinking into that tissue, then you'll sink into the stylohyoid muscle itself. So first thing we're going to do is we're going to find the mastoid process with our middle fingers on either side. Either middle or index finger, whatever is most comfortable for you. I like to use my middle finger. And then we're gonna slide off the mastoid process into that space. So as you slide off the mastoid process with my middle finger and my index finger, I'm getting the digastric here. I'm getting the attachment right here. I'm sinking into it, and then with my middle finger, I'm getting the stylohyoid muscle, and I'm just sinking into those muscles, just applying pressure inward, and then also applying some shearing force, so just really dragging that skin and the underlying tissue down with it. And once I meet resistance, I'm kind of pausing there, breathing into it a little bit, and then just kind of letting it go, just applying a little bit more pressure, and just letting it slowly, gradually give way. And you go all the way down to the hyoid bone here with that. So next part of the treatment, take your fingertips, index or middle finger and ring finger rather, and you just want to find the tip of your chin right here and just kind of fall underneath that, under your mandible, and then just sink into that tissue. So again, just to give you an idea of the muscles that you're treating, this is the floor of the mouth, and you see this long muscle that attaches right down to the hyoid bone. That's the geniohyoid. This more flat ribbon-shaped muscle, that's your myohyoid right there. So that those two muscles primarily form the floor of the mouth. So that's really what you're treating here with this part of the technique. You're just falling off the edge of the mandible, sinking into those two muscles, and then I just kind of spread my fingers. And I want you to go really slow. Really just try to feel all the little subtle differences in the tissue depending on where you are. There's no rush with this. It's not like you're doing 10 sets of 10 or whatever. There's really no guidelines other than just you doing the basic techniques and then going from there and making them your own, exploring yourself, finding where the tight spots are, finding where the resistance is, and then just kind of experimenting with pressure, adding a little bit more pressure, trying to get that good release in the tissue, trying to see if you notice a change. And if you have tinnitus, if you have any kind of sleep disordered breathing, if you have any kind of balance issues, this is all really good stuff to do, because these muscles often contribute to a lot of those issues when they have trigger points. So if you find a really tight spot, a tender area, it's probably a trigger point, and especially if it recreates your symptoms. So if it recreates the ringing in your ears, if it makes you suddenly lose your balance, that's a good indication that a trigger point is probably causing those issues. And again, really influential on the position of the jaw, which has a huge impact on your airway. So if you have any kind of sleep disordered breathing, this is a great technique to do, particularly if you do have a head forward posture, because that probably means that your jaw is adapting to that head forward posture by shifting back, all these muscles in the floor of the mouth tightening, and then closing off the airway. So really important to get these to loosen up, to make sure that the jaw can sit forward nicely in the temporal mandibular joint here, and you can have a nice open and clear airway. So that's it for now, guys. Hope you found this video useful, and we got a lot more coming up, so stay tuned.